Good morning, everybody. My name is Paul Devlin, and I'm the Trust Chair at Nottinghamshire Healthcare. And I want to just begin by saying thank you for joining this recruitment fair. It's a really exciting event for us, and I'm delighted that you've chosen to spend time with us today. In a little while, I'm going to introduce Gabby from Leaders Unlocked and MH2K, who's going to talk about how young people will be involved today, really important for us. And then Rachel Towler, who will talk a little more about CAMHS services. But I just wanted to begin by saying a little bit about the Trust in general. You may not be familiar with us. We are ambitious in, as our vision says, making a difference for the people of Nottingham and Nottinghamshire, and indeed in other counties where we also offer services. And we've got about 9,000 staff, and we'd really love you to come and join us as well. We operate out of over 140 trust sites, including community settings, acute wards, and secure settings. So we're a complex, broad organisation. Now, for us, our trust values really matter. They were co-produced with our staff. That's a really important principle for us as an organisation. And our values are honesty, compassion, trust, respect, and teamwork. And we work really hard to show and live those values throughout all that we do. And I very much hope that they will shine through in the sessions that you join today. I must say that I am, along with the Trust Board, committed to us providing the very best services we can for those who need us. And a key part of this is for us to be the very best employer we can be. And I'm personally committed to us being an organisation that welcomes a diverse workforce. I want you to feel confident that you can bring your whole self to the workplace, because I know that a diverse workforce provides the best possible services. So I hope that you will take away from today a sense of what we are really like as an employer, and also you take away a desire to come and join us. So I'm not going to say any more at this point. I'm going to hand across to Gabby Jones. Gabby, over to you, please.
Thank you so much, Paul. That's great. So hi, everyone. My name is Gabby Jones. I am the project manager of MH2K, and I also work for Leaders Unlocked. So Leaders Unlocked is a social enterprise that was established in 2014. So we're a London-based company, but I'm based in Nottingham and Nottinghamshire. So in 2016, MH2K was established with the view to get young people's voices heard at national and regional levels. And MH2K is especially special because it allows young people to get involved in projects like this, events like this, to make sure that their voices are heard. So throughout today, we have some amazing young people who we call citizen researchers, who will be delivering some amazing workshops and engagement activities with you all to kind of talk about, from a young person's perspective, what it's like to be involved in this opportunity and to be involved in CAMHS. We also will be doing some quizzes and actually just asking you guys questions who are looking to be involved in CAMHS, hopefully after this recruitment session, to kind of ask about what would you bring to young people if you wanted to join CAMHS. So we just wanted to make sure that today young people's voices are heard throughout today's session, and we can't do this without the amazing support CAMHS has shown us over the past 4 or 5 years since being on MH2K. So we're really privileged and honoured to be here today. So thank you so much. Again, I won't take up too much of your time. We've got so much great activities what are going to be happening today. So I'd like to hand over to now Rachel. So thank you.
Yes, Rachel, let's go across to you to introduce a little bit, say more about our actual CAMHS services.
Okay, thank you, Gabby, and thank you, Paul. So morning, everybody. So my name's Rachel Towler, and I'm the operational manager within Notts Healthcare Trust, and I have a responsibility within my portfolio not only for CAMHS but also for perinatal mental health and for adult eating disorders as well. but we're focusing on CAMHS today, which is an amazing service, a really rewarding area to work in, and there's lots of great opportunities. We've got lots of growth happening within our CAMHS services at the moment, so lots of transformation, lots of new ways of working, and some really great opportunities. So within our CAMHS portfolio, we've got not only our community services, but we've also got inpatient services as well. Over at Hopewood, for those that know Nottinghamshire, it's a fantastic new build. We've been open a few years now, but it is a fantastic place that was purpose-built with young people involved. So it was a co-production building. So our inpatient wards, it's called the Lookout on the Hopewood site, and we've got 3 wards. One that's a general adolescent unit, one that's a specialist eating disorders ward, and one psychiatric intensive care unit. So that's a really great inpatient facility for young people, and it's sort of quite unique within the East Midlands region. We're the only provider of a psychiatric intensive care unit within the East Midlands. Within our community teams, they are huge, our community teams, with lots and lots of diversity across those teams. We have a single point of access where all the referrals come through for our community services, and that has within it admin staff as well as clinical staff to screen referrals. We have an amazing mental health support team that works across the whole of Nottinghamshire, and they work within our school environments, and they're one of the first services to be operational within the country. So they're a great team. We have a primary mental health team that work with our referrers and offer education, training and consultation to our referrers. We have 3 community teams that work across the whole geography of Nottinghamshire, up towards Bassetlaw and then down towards sort of Rushcliffe area. So we have quite a big geography, and we call them the North, West and South teams. We have a head-to-head service that works with young people that are within the criminal justice system and early intervention psychosis. We have a service for young people that are within the looked after system, children in care. We have an eating disorders services for young people. We have an intellectual disability CAMHS team. We work with Clayfields, which is a young person's residential secure unit. We have a neurodevelopmental team that specialise in tics and Tourette's, and they're again nationally and internationally renowned service. We have a crisis team, crisis and liaison team, and they work across the whole geography, and it's a 24/7 service, so that's a fantastic team. We have an FCAMHS team, so that's a forensic CAMHS team that work with young people that are really struggling from a forensic perspective, and that's for the whole of the East Midlands, not just for Nottinghamshire. So we provide that service across all of the East Midlands geography. So that's, I know, a really quick run through of our sort of CAMHS services, and I know that this morning it'll be throughout today it'll be a great opportunity to meet with people, and I think that Rachel Darcy has asked for me to hand over to the sort of workshop facilitators, and they'll be sort of introducing themselves now to the workshops and activities that will be taking place throughout today. So thank you.